Well, welcome to the stroke webinar. My name is Dr. Robert Brown. I'm a neurologist at the Mayo Clinic in Rochester, Minnesota. My colleague, Dr. Giuseppe Lanzino from the Department of Neurosurgery at the Mayo Clinic in Rochester, Minnesota. Today, we'll have the opportunity to talk about the topic of stroke. I will start out with a presentation regarding the prevention and diagnosis of stroke. And my colleague, Dr. Lanzino, will then discuss surgical and non-surgical treatment options for stroke. Now, to start today, we'll talk about the topic of stroke in a very general type of way. And the first slide that I'm going to show you, which will come up in just a moment, provides some of the information for us just to give some understanding of the public health significance of stroke. I'll just click forward to that. Oh, here's an overview of what I'm going to be talking about today in terms of prevention and diagnosis of stroke. Before I did that, though, I wanted to just mention how frequently stroke is in the United States. About 800,000 strokes occur each year in the United States. There are 3 million stroke survivors in the US. This is a very, very important entity in terms of it causing death and disability. About a third of patients who have a stroke die within a month of that stroke, and about 2/3 have a disability from that stroke, and it is the leading cause of disability in the United States. Now, fortunately, as we'll talk about over the next few minutes, many strokes are potentially preventable, and when a stroke does occur, there are acute treatment options that exist, and that's what makes it important for us to talk about the concept of stroke as we're doing today. The overview of my presentation is as summarized here. What is a stroke? What can I do to prevent a stroke? Very importantly, we will consider a number of stroke prevention strategies. What are the symptoms of stroke? And what should I do if stroke symptoms occur? And so we'll quickly work through these. Now, I mentioned a moment ago regarding the overall public health significance of stroke, so I won't review this in great detail, but I think it is important, again, to understand these statistics that stroke occurs every 40 seconds in the United States. It's an extremely common entity, the 4th leading cause of death and the leading cause of disability. I mentioned 3 million stroke survivors, and it's a very important impact on death. Here it lists the 3rd leading cause of death, and it varies from year to year in terms of 3rd versus 4th leading cause of death. Very important cause of disability, and it's a very costly disorder as well. $74 billion a year spent every year in the United States. Now, I want to step back and consider, what is a stroke? It's a broad-based disorder that affects the brain tissue, and far and away the most common cause of stroke is what's called a cerebral infarction. And this occurs when there is a sudden lack of blood flow to the brain, and the blood provides the brain with the oxygen that it needs for the brain cells to survive. And so when that blood flow is lacking, the brain cells quickly begin to die, and that's called an infarction. And again, about 85% of all strokes is a cerebral infarction. About 15% of strokes are bleeding kind of strokes. That is, in the brain tissue, an artery ruptures, causing blood to spill into the brain tissue or over the lining of the brain. And this, again, is a bleeding type of stroke, about 15% of strokes. I also want to mention the concept of a TIA. A TIA is transient ischemic attack. Transient meaning the symptoms come and go, lasting less than 24 hours. Ischemic, or lack of blood supply to the brain. And attack, meaning it's sudden in onset. So these are transient symptoms. Now, even though the symptoms come and go, it's important that we don't ignore those symptoms, because it's very important in terms of a warning sign of a future stroke. So as we'll talk about in a moment, if you do have the onset of these symptoms, even if they're transient, please see a healthcare provider immediately, because it is such an important warning sign of the potential for a future stroke. Now, remember a moment ago I mentioned cerebral infarction, about 85% of all strokes, and this diagram helps to display what can occur in stroke. It's important to note that the potential site of the blockage can be up in the brain or in a cerebral artery. It can be in the neck, in one of the arteries in the front part of the neck called the carotid artery, or it can be in an artery in the back part of the brain, the vertebral or basilar artery. And again, about 85% of strokes. I'll come over to the diagram here on the right side. This is the carotid artery in the neck, and sometimes plaque can form in the neck. Dr. Lanzino will discuss in a moment regarding potential options for treating that plaque. Or the blockage might be up in a brain artery far upstream, if you will, up after the artery enters into the brain tissue. Now, where does that artery blockage come from? Well, sometimes a little clot can form in the heart. There are potential heart abnormalities in terms of the structure of the heart, or certain types of irregular heartbeat can lead to a clot forming in the heart, and then that little clot can break free and go up into the brain. There may be a narrowing of the artery of the neck, as I showed on the last slide. There may be an artery that is narrowed after that artery enters into the brain tissue, or there may be an area of narrowing in a tiny artery up within the brain. And then finally, certain blood clotting disorders can also lead to blockage in an artery. So there are a whole number of potential clot sources that can then lead to a blockage of an artery and lack of blood supply to the brain. I mentioned a moment ago the hemorrhage type of stroke, and this just shows a diagram in terms of a little blood or bleeding into the brain tissue caused by a fragile artery that then ruptures and leads to bleeding into the brain. About 15% of all strokes. Excuse me. And in terms of potential causes of bleeding, high blood pressure is an important, potentially preventable cause of bleeding into the brain. Certain medications such as aspirin or Coumadin and other blood thinners, an aneurysm, which is a little bubble or saccular-like outpouching that forms on an artery. Certain tumors can bleed, and blood vessel malformation, such as an arteriovenous malformation. And over on the right is a picture of an aneurysm, this little bubble or sac-shaped protuberance that forms right off of an artery, and then that can rupture, that leads to bleeding into the brain. Now, I'll just show you, when you present to a hospital, sometimes a CAT scan, which is a picture, a fancy X-ray type picture of the brain will be performed. And this slide shows you what a stroke might look like on a CAT scan. Here you see on this CAT scan a large area of damage to the brain tissue that's caused by a lack of blood supply to the brain, a cerebral infarction. This is a bleeding into the brain called an intracerebral hemorrhage. And then this is another type of bleeding stroke called a subarachnoid hemorrhage, and this is often caused by an aneurysm, that little bubble or saccular type outpouching I mentioned a moment ago. Now, what about stroke prevention? What are the risk factors for stroke? Well, some risk factors you cannot change. And as this diagram shows, age is a very strong risk factor for stroke. This just shows you the frequency of occurrence of stroke dependent on age. And that is a risk factor that we can't do anything about. Gender is a risk factor for stroke as well. Race, that is, the risk of stroke is higher in African Americans. There are certain genetic disorders that can lead to a higher occurrence of stroke. And geography. There are certain areas of the southeastern US, what's called the stroke belt, that has a higher occurrence of stroke as well. But again, most of these, for the most part, these factors cannot be changed. Now, there are, though, many factors that can be changed. And some of the most important risk factors for stroke include high blood pressure, cigarette smoking, diabetes, and high cholesterol. And those are the four that are the strongest risk factors for stroke, but there are others as well. And those include excess alcohol intake, usually considered to be greater than 2 alcoholic beverages per day for men and greater than 1 per day for women. The higher and higher one goes above that, that's on a daily basis, the higher is the risk of stroke. Obesity, a sedentary lifestyle with physical inactivity, a sleep disorder called obstructive sleep apnea, all independent risk factors for stroke. An irregular heartbeat called atrial fibrillation, narrowing of the carotid artery in the neck caused by plaque or atherosclerosis, and then artery diseases elsewhere in the body also portends a higher risk factor or higher risk of stroke. But just to consider a few of these risk factors again for a moment, I want to again comment on high blood pressure, smoking, diabetes, and high cholesterol. These are all risk factors for plaque formation or narrowing in an artery. And this is a diagram of an imaging study of the carotid artery. And here, right at the tip of the arrow, is a narrowing in that artery. And we'll hear more in just a moment regarding how, from Dr. Lanzino, that is, regarding how that might be treated. There are treatments that do exist. And again, to talk about the risk factors that are modifiable, high blood pressure, several of the parameters I've listed here, and certainly if you're finding that your blood pressure is in general running greater than 140/90, you should visit with your healthcare provider. There are many different blood pressure medicines that exist. Many of them are quite low in cost. I don't want you to feel that the cost is going to be extreme to treat the blood pressure, because many of those blood pressure medicines are relatively low cost. And fortunately, there are so many options. Typically, a blood pressure medicine that is well tolerated and relatively inexpensive is available to help to control your blood pressure. So know your blood pressure. If it's high, work with your healthcare provider to treat it. I should also mention that reducing the salt somewhat in your diet, exercising and losing weight serve as a complement to the blood pressure reducing medications. Cigarette smoking. If you don't smoke, don't start. And if you are a smoker, there are excellent strategies that exist to help you to quit smoking. And so never feel that you've smoked too long, that it's not worthwhile quitting, because that's not the case. Fortunately, the health benefits of smoking cessation are significant, some of which you will capture the benefit very quickly after quitting smoking, and others will occur in the months and the years ahead. But do quit smoking. There are, again, medicines available to help to reduce the craving, and so work with your healthcare provider. Great options that exist. If you have diabetes, work with your provider to control that diabetes to the extent possible, and that will help to lessen the risk of stroke. Likewise, there are certain types of blood pressure medication, certain types of cholesterol-lowering medicine that would be used if you had diabetes as well. Elevated cholesterol. Well, there are several excellent medicines that exist now to help to supplement dietary treatment of elevated cholesterol. What one wants to do is lower the bad cholesterol, called the LDL, and do everything possible to increase the good cholesterol, called the HDL. And there are dietary factors, that is a healthy diet, which will help to lower the cholesterol. Exercise and weight loss can have a prominent benefit as well. Lowering the saturated fats and trans fats in the diet is key. Increasing fruits and vegetables, and there are some cholesterol lowering spreads that you can purchase in the grocery store as well. And then what are called statin medications. There are a whole number of very powerful cholesterol lowering medicines that can be used as well. Fortunately, several of these now are available as generic, so they are very low cost, and your healthcare provider can find a statin agent that should be very low cost and very effective for you if needed. Obesity and physical inactivity are also risk factors, and of note, the amount of physical activity that you need on a weekly basis does not need to be striking to achieve a benefit from that. If you can try and find 30 minutes in your day to have some physical activity, doesn't have to be intense exercise, a brisk walk or some other associated activity or activity consistent with that level of physical activity, I should say, is perfectly fine, but up to about 30 minutes a day. And if you can even carve that out 4 or 5 days a week, you will achieve benefit from that in terms of stroke reduction. Now, there are a number of other risk factors that patients will sometimes ask about, and important to point out, interestingly, dental issues and challenges in your dental care. Gingivitis is a risk factor for stroke, bacterial infection. Stress is a risk factor as well, but often is associated with high blood pressure and some other factors. And recreational drug use is a clear risk factor as well. Now, sometimes asked if people have read about dark chocolate, does that decrease risk? Well, there are some data that suggests that dark chocolate may decrease risk, but this doesn't mean a box of dark chocolates a day. This means that on a very low level, a piece or two of dark chocolate a day, it ends up that there's a chemical in dark chocolate that has a positive impact on artery and artery health, interestingly, but it's at a low level, a piece or two of dark chocolate a day. Omega-3 fatty acids, whole grains, and fruits and vegetables. And in particular, there's a study recently published regarding white fruits and vegetables, and it indicated that the benefit was rather impressive. For every 25-gram increase in the amount taken per day, there was a 9% risk reduction in stroke. And so just to give you some idea of how much does that mean, well, one apple has 120 grams. And so the apple a day adage seems to hold some truth to it, but many, many other fruits and vegetables as well. Apples, pears, apple juice, applesauce, and then bananas, a number of vegetables as well, all of which can reduce your risk of stroke, and taken it even if taken in at a relatively low level. No change in risk. Vitamin E supplementation, vitamin C supplementation does not reduce the risk. Now, what are the symptoms of stroke? Well, for the most part, symptoms of stroke occur quite quickly, and I would like you to know each of these warning signs of stroke and keep these in mind. Sudden onset of decreased vision, sudden numbness, meaning lack of feeling in the face, arm, or leg, sudden weakness in the face, arm, or leg, sudden difficulty talking or understanding others. And I should mention that isn't just stumbling over a word now and then, which we all do, but instead, these are symptoms that come on and last many, many minutes or even hours. And so it's quite prominent, and it will be recognized when it's occurring. Sudden unsteadiness of walking or a sudden severe headache, unlike anything you've had before, excuse me, all of which are risk factors for stroke. Now, there is the acronym that has been suggested in terms of something to remember. That's the FAST acronym. F for face, meaning ask the person to smile. Do they have a facial droop? A for arm, ask the person to raise their arms, and if one of them is not elevating at the same level as the other. S for speech, do they have slurred speech? Ask them to repeat a word or a sentence, or the speech, there's the speech slurred. And then T is time. Time is critical, and if you have any of the symptoms as noted on the previous slide or as noted in this acronym, present to the hospital immediately, because there are treatments that are available. So what to do if you have the onset of symptoms? Well, the earlier you can receive treatment for your stroke-like symptoms, the better. There are clot-dissolving medicines that can be used, but they're most beneficial if used within the first several hours of onset. Don't ignore warning symptoms. If you do have transient symptoms, such as I alluded to earlier in this presentation, don't ignore them. Do seek your healthcare provider's input, even if those symptoms are transient. But when the symptoms do occur, if you or loved one or friend is having stroke-like symptoms, as noted on the previous slide, call 911 and seek emergency medical care, because there are treatments that exist. We are now using clot-dissolving medicines called TPA, clot buster, if you will. And so the immediate question we ask when we see a patient is, can we use one of these? There are new devices. These are catheters, little plastic tubes that are inserted directly into the artery that will extract the clot. And Dr. Lanzino will discuss that in a moment. Your provider will look into what caused that stroke to try to implement a strategy to prevent a second one from occurring in the future. And that's very important as well. If a person's had a stroke, they're at high risk of having a second stroke. And so we do everything possible to reduce that likelihood. So the key points from this part of the presentation are the following. Be aware of your stroke risk factors. It ends up that many strokes can be prevented. And so know those stroke risk factors, know your blood pressure, stop smoking if at all possible, and seek assistance to help you to quit smoking. If you have diabetes, treat that aggressively, and high cholesterol, we can work with you to lower that as well, and the other risk factors I mentioned. Know those symptoms of stroke and do not ignore them, even if they are temporary in nature. And if you or a relative or a friend are experiencing symptoms of stroke, call 911 because we do have treatment options that exist. They can be very effective, but they're most effective if started early. Now I'm going to again introduce my colleague, Dr. Giuseppe Lanzino from the Department of Neurology here at Mayo Clinic in Rochester, Minnesota.
Thank you. I will review some of the surgical options for both the prevention and treatment of stroke. And in particular, I will touch upon the treatment of so-called asymptomatic as well as symptomatic carotid stenosis, discuss issues about surgery, the medical technical term being carotid endarterectomy. I will also discuss about carotid angioplasty and stenting and provide a quick review about some of the options that we have available in patients who present immediately after a stroke to reopen a blocked blood vessel. Now, when we think about surgery to prevent a stroke, as Dr. Brown mentioned, ischemic stroke, so that's type of stroke that is related to blockage of a blood vessel, usually we refer to carotid artery surgery.
Each carotid artery has an internal and external branch. The external arteries supply blood to your face. The internal arteries supply blood and oxygen to your brain.
And therefore, when we think about surgery, usually we are talking about surgery involving the internal carotid artery, which is that artery providing blood to the brain.
With atherosclerosis, fat and other materials stick to the smooth walls of arteries and become hard. This substance is called plaque. The rough surface collects more material, gradually narrowing the artery. When plaque builds up in one or both of the internal carotid arteries, it's called carotid artery disease. In some cases, an internal carotid artery may become completely blocked. If the flow of blood and oxygen to the brain is reduced, a stroke may occur. However, in some people, arteries at the base of the brain take over the role of a blocked carotid artery, keeping the brain supplied with oxygen and preventing a stroke. Sometimes a piece of plaque breaks off and lodges in a blood vessel upstream of the carotid artery, blocking blood flow to part of the brain. In this case, other blood vessels cannot make up for the lost blood supply. A stroke may occur. Some people with carotid artery disease experience a so-called mini stroke.
So with the aging of the general population, blockage of the carotid artery is actually very common, but not every patient, every person with the blockage of the carotid artery needs surgery, because many of these patients can be effectively treated with medications. As we have seen, the brain, even in the presence of a blocked carotid artery, can find other ways to provide blood supply to that part of the brain normally fed by that blocked artery. It is also important to distinguish between patients who are symptomatic versus patients who have not had symptoms, and therefore they are defined asymptomatic. As Dr. Brown mentioned, symptoms of carotid stenosis include weakness of the opposite side of the body, speech dysfunction, and temporary loss of vision in one eye. These are some of the diagnostic modalities that we use to diagnose a blocked carotid artery. This is what's called a catheter angiography. And you can see this is the carotid artery. This is the internal carotid artery going to the brain. And you can recognize the blockage. Well, this is the external carotid artery, which provides blood supply to the face. This is a different methodic. It's a CT angiogram, and this is an MR angiography, all showing the same issue in the same patient. Once again, I like to stress that in the presence of blockage of the carotid artery, but no symptoms related to carotid stenosis, many patients can be effectively treated with medications alone. When we establish that there is an indication to reopen that blocked carotid artery, that can be done either with surgery or with stenting. With the surgery, what we do is we place an incision underneath one of the muscles of the neck, and this will expose the internal carotid artery. And you can see that the vessel is clamped to interrupt the blood flow. The plaque is removed, and then the vessel can be sewn back together either with the patch, like this case, or primarily as shown in this illustration. Patients that are considered that need treatment but are considered to be at high risk for surgery might be candidates for angioplasty and stenting. With angioplasty and stenting, as shown in this animation, usually a filter device is deployed past the stenosis. And this filter has a protection function. Then a balloon is inflated across the plaque to reduce the blockage. And you can see the role of the filter is to block any debris that might be released during these maneuvers. Eventually, a stent is placed across the stenosis. And after the procedure is completed, the filter, it's captured and removed. For patients who present with a stroke, an acute stroke, and the stroke is related to complete blockage of one of the blood vessels inside the brain, there are different modalities that can be used to try to reopen this vessel. And this can be done with medications or can be done with so-called mechanical devices. And some of these devices are, like in this case, are called stent retrievers, in which case a stent is deployed inside the blood clot that is blocking the vessel. And then after the stent is deployed, the function of the stent is to capture that blood clot, and eventually the stent is withdrawn, and in about 80% of patients, we are able to reopen that blocked blood vessel. Another alternative device is it's an aspiration device where a catheter is placed immediately proximal to the occluding clot. The catheter is then connected to an aspiration pump, and with the combination of the aspiration and the action of the catheter, the clot is removed. These devices, as well as medical therapy for completely occluded blood vessels, so-called TPA, are available, but only for those patients who arrive to the hospital within the first few hours after stroke onset. So in summary, carotid stenosis is a very common condition. Surgery for patients with carotid stenosis but no symptoms is indicated only in a minority of selected patients. Treatment of symptomatic carotid stenosis is indicated in patients who have a greater than 75% stenosis, and also in selected patients with the stenosis less than 75%, but with recent symptoms. Surgery is so-called carotid endarterectomy is the gold standard for patients with the severe narrowing of the carotid artery, while angioplasty and stenting is reserved for those patients considered to be at high risk from surgery. To be effective, any of these treatment must have a very low rate of complications, In selected patients presenting with acute stroke within the first few hours of onset, either medical therapy or mechanical clot retrieval are valid options to try to reverse the stroke. Thank you, and we'll be happy now to answer any question.
So the first question is, if I were to have a stroke, what should I do? Well, if you or a loved one notes the onset of symptoms, as we talked about earlier, what you should do immediately is call 911 so that emergency medical care is on the way. If it's going to be a few minutes until that is going to arrive or until you can get to the hospital, it is reasonable for you to take an aspirin at that point in time. It's important to mention, though, that about 15% of all strokes are bleeding kinds of stroke, 85% are lack of blood supply strokes. So if there is a prominent headache associated with your symptoms, perhaps hold off on the aspirin. But if it's mainly, or I shouldn't say mainly, if it's the abrupt onset of the weakness, numbness, difficulty speaking or understanding others, difficulty with your vision, unsteadiness, that is those abrupt stroke-like symptoms, taking an aspirin at that time and seeking emergency medical care would be reasonable. Perhaps I'll ask Dr. Lanzino to comment on acute treatment options again for patients presenting with acute stroke.
Well, acute treatment options include medical and the so-called endovascular therapies. These therapies are effective only in those patients who come to medical attention within as soon as possible, and usually within the first few hours after stroke onset. So presence of any symptom which might represent a potential stroke, it's important to seek immediate medical attention. These options include intravenous TPA or endovascular treatment, where through a catheter inserted through an artery, the clot is removed.
The other thing I would add to Dr. Lanzino's answer is when it comes to intravenous TPA, that is FDA approved for use up to 3 hours after onset. However, there are several research studies that suggest that that treatment option is effective up to 4.5 hours. And so at many major medical centers around the world, for the right type of stroke in the correct patient, the intravenous therapy is delivered up to 4.5 hours of onset. The endovascular treatments that Dr. Lanzino mentioned, those can be extended even beyond the 4.5 hours as well. So there are those treatment options that exist even up to 6 to 8 hours, sometimes even a little bit longer, depending on the location of the stroke. Next, what should a bystander do if they witness a stroke? Well, if you see somebody who has the abrupt onset of those symptoms I talked about earlier, just keep them safe and comfortable as they have that deficit. But the most important thing you can do is call 911. And fortunately, in today's age where cell phones are so clearly available to everyone and the ability to call 911 acutely is available right there, is right on your cell phone. Call 911, tell them where you are, get the ambulance there immediately. Because the faster that they get to a hospital, have a CAT scan performed, have an acute evaluation by the emergency department provider, that's when you can make a decision regarding the clot dissolving therapy if they're a candidate for that. So above all else, if you witness a stroke, call 911, keep that friend or loved one or person comfortable until the ambulance comes within a hopefully very short period of time.
There's a question, why do I need to act fast if there is a stroke? Well, it is important to act fast, as we mentioned before, because some of the treatments that we have available for an acute stroke are only effective if patients are seen in the hospital in a prompt fashion.
One other thing I would add to Dr. Lanzino's comment as well is even though the intravenous therapies, as an example, are available at least up to 3 hours and actually up to 4.5 hours, it ends up that the faster you receive that treatment, the better off your outcome is going to be. So if you can be treated at 90 minutes, actually you will do better than if you're treated at 3 hours, which is 180 minutes. So that's why it's so important to seek emergency care. Is there such a thing as having old stroke symptoms? And if I understand the question correctly, the question is, can it sometimes persist over the course of time, or can old stroke symptoms worsen at some point? Well, unfortunately, a high proportion of people, high percentage of people who have a stroke will have some symptoms that remain. After you present with a stroke, your healthcare provider will quickly evaluate the cause of that stroke and implement any strategies possible to reduce the risk of having another stroke. And they'll also work with you in a multidisciplinary team with speech therapy, occupational therapy, physical therapy, often a combination of those to help you with the deficit. But some of your symptoms of the initial stroke may persist over months and years after that. You oftentimes will see improvement for months and years after your stroke, but some of the symptoms can remain. And in some patients who have remaining or residual weakness or some other difficulty, if they have a medical illness, such as a bad cold or influenza, or they're extremely fatigued for whatever reason, sometimes their symptoms from their initial stroke can worsen a little bit in that context. And perhaps that ties into the question that was asked as well. The next question is, what does a multidisciplinary approach mean for a stroke victim stroke care? Well, a key approach to somebody that's presenting with a stroke is to have emergency medical services bring that patient to a hospital very, very quickly. And then at that hospital, which is often the closest hospital, have the emergency department providers, and if there is a neurologist available, quickly become involved in the patient care. But then very quickly, after that acute period of the first several minutes, one will then interact with other colleagues, neurosurgery colleagues, neuroradiology, physical medicine, and rehabilitation. These are all components of the multidisciplinary team that will care both acutely and in the days that follow for that stroke patient. There is what is called a primary stroke center designation. This is a specific credentialing or accreditation that's been provided to hospitals who have displayed that they can treat acute stroke at a high level and bring the appropriate team together to do so. But I think that's, in today's age, for all medical entities, the ability to bring a multidisciplinary team together to deliver care is really optimal. And stroke is certainly a great example of that. The next question, can victims of stroke ever return to normal? And the answer is absolutely. Fortunately, with some of the new acute treatments that we have available, patients have a higher likelihood of coming to have no or minimal deficit than they otherwise would in the absence of those treatments. In addition, fortunately, some strokes end up being relatively mild from the beginning. That is, even within the first several hours after the stroke, they will improve and it'll be relatively mild. But still other strokes where they have a deficit that is present after the first day or two with a combination of therapies, physical therapy, occupational therapy, and speech therapy, as the days and weeks go by, they will oftentimes improve quite extensively and be able to return home and enjoy their friends and family, potentially return to work. And so that is certainly the case. Now, I don't want to in any way understate the impact of stroke, because sadly, a third of patients who have a stroke do die from that stroke. And so it's a very important issue there. And about 2/3 of stroke patients have some disability, but fortunately, with these various strategies as we team up with our neurosurgery colleagues like Dr. Lanzino and with our physical medicine colleagues, speech therapists, and others, oftentimes we can help the patient to reduce the disability to the great extent. Dr. Lanzino, any other questions or any other comments rather you'd wanted to make on that?
No, it's important to realize that, yes, unfortunately, stroke has a major impact on many patients, but also many stroke victims over time, they do improve from their deficits. And quite often the recovery takes time, but improvement can be seen up to a year or two after the onset of a stroke.
Good. The next question is, what can we do for follow-up of a TIA? And remember again, TIA stands for transient ischemic attack, and that is a situation where these stroke-like symptoms occur, oftentimes abrupt onset, but then they disappear within several minutes or an hour or two, and they're left with no deficit. And an important point there is to not ignore those symptoms. Sometimes we think, well, the symptoms have been temporary, must not be anything to worry about, but truly those symptoms are extremely important because they do predict a higher risk of stroke in the months ahead. And so seeking input from your care provider is important. And what they do in that situation, what your healthcare provider will do is try and define exactly why did that TIA occur? Is there a narrowing of the carotid artery in the neck? And if so, we'd ask for the assistance of a colleague like Dr. Lanzino. Is there an irregular heartbeat such as atrial fibrillation? This is a specific and relatively common type of irregular heartbeat. We use clot or I should say blood thinning medicines in that context to reduce that risk of occurring. Or is there a narrowing up within the arteries up in the brain? There's all sorts of potential causes of TIA, but what one can do after performing some additional studies, such as a carotid ultrasound, which is a sound wave test of the heart, assessing the heart, maybe with taking a image or picture of the heart called an echocardiogram, a scan of the head, and MRI or a CT, and a number of blood tests. Your provider can then implement the best strategy for reducing your risk of stroke after that TIA. And it might come down to taking aspirin, treating your blood pressure, using a cholesterol lowering medicine, or maybe we need to do those things and also ask for the assistance of somebody like Dr. Lanzino for a carotid artery narrowing. So we both assess for the specific cause of stroke, but also will assess for your risk factors as well to make sure your blood pressure, any smoking issues are addressed, diabetes, high cholesterol, address those very extensively. Dr. Lanzino, would you like to comment regarding the next question regarding how important is a blockage as a cause of stroke? And I think they mean artery blockage.
Well, usually about 1 out of 3 strokes are related to blockage of a large vessel, and the most common one being the internal carotid artery. So it is definitely one of the most important causes of strokes.
Very good. We also have a question regarding migraines and chronic headaches, and how does one know if one of those headaches is something more? And this is an excellent question. As I had alluded to earlier, one of the types of stroke can have a marked headache, severe headache associated with it. Actually, many strokes don't have headache associated with it, but in particular, some of the bleeding types of stroke do. In answer to this specific question, I think it's important to recognize that a very, very, very high percentage of headaches are not related to stroke at all. And how does one know? Well, the type of headache that occurs in the setting of one of these bleeding types of stroke is unlike anything a person has ever had before. It's like somebody has literally gotten hit over the head with a baseball bat. It's sudden in onset, very, very severe, unlike anything that they've ever had before. And so if one has a history of chronic headaches, or in our patients who have migraine headache, if it's a very similar type of headache, even though it's severe, and migraine headaches can be severe, but if it's a very typical type of headache you've had before and it's unassociated with any other symptoms, then it's likely that that isn't anything to worry about. But if you have the sudden onset of a severe headache, literally unlike anything you've ever had before, then it would be worthwhile to seek care and make sure that that's not something more worrisome. Next question is, I've read that glucose monitoring post-stroke, regardless of being diabetic, is important, and should it be part of post-acute stroke care? Well, when it comes to glucose or blood sugar management, there is some importance to that actually in the acute period after stroke as well. If somebody is presented with an acute stroke and if their blood sugar is elevated, we'll oftentimes implement certain strategies, sometimes using insulin or other strategies, to lower that blood sugar level, because it ends up that in the setting of acute stroke, if the blood sugar is quite high, that can increase the risk of a bad outcome from that stroke. So it truly is in that acute period that we worry about the blood sugar glucose level. And then beyond that, it is more in the patients who are diabetic. If they're diabetic, we work with them to both on their diet, and there are both oral medications as well as insulin that may be used in diabetics. And importantly, in diabetic patients, there are specific types of blood pressure medicine that can be most effective for them. And also importantly, the statins, a specific type of cholesterol-lowering medicine, is important in that, particularly important in that diabetic group as well. Very good. Well, thank you for joining us today and for your time. We hope that this was of interest to you. We'll try to answer any additional questions that arrive to us, and we'll get to those in the week ahead. But again, all the best to you, and thank you for your time today. And we hope you have a very, very nice day and nice week. All the best.
Thank you.